Interstitial lung disease. Pulmonary fibrosis is thickening of the interstitial septum of the lung between the arteriolar space and the alveolus. Fibrosis interferes with gas exchange in both directions. Fibrosis can be idiopathic or secondary to a large number of inflammatory conditions, radiation, drugs, or from inhalation of toxins. All of them thicken the septum. Only some have white blood cell infiltrates with lymphocytes or neutrophils. Chronic conditions lead to fibrosis and thickening. It is also known as idiopathic fibrosing interstitial pneumonia. Specific causes of pulmonary fibrosis. Idiopathic. Interstitial pulmonary fibrosis radiation drugs, bleomycin, busulfan, amiodarone, methotrexate, nitrofurantoin, cyclophosphamide, methotrexate. Inflammatory infiltration with white blood cells is reversible, treatable, whereas fibrosis is irreversible. Presentation. All forms of pulmonary fibrosis, regardless of etiology, present with dyspnea, worsening on exertion, fine rales or crackles, on examination, loud P2 heart sound, clubbing of the fingers. Methotrexate causes fibrosis of both liver and lung. Diagnostic tests. The best initial test is always a chest X-ray. High-resolution CT scan is more accurate than a chest X-ray, but the most accurate test is a lung biopsy. Echocardiography will often show pulmonary hypertension and possibly right ventricular hypertrophy. PFTs, restrictive lung disease with decrease of everything proportionately. The FEV1, FVC, TLC, and residual volume will all be decreased. But since everything is decreased, the FEV1, FVC ratio will be normal. The DLCO is decreased in proportion to the severity of the thickening of the alveolar septum. Biopsy shows granulomas in berylliosis. Treatment. Most types of interstitial lung diseases are untreatable. If the biopsy shows white blood cell or inflammatory infiltrate, prednisone should be used. Of all the causes of pneumoconiosis, berylliosis is the most likely to respond to treatment with steroids. This is due to the presence of granulomas, which are a sign of inflammation. In patients who do respond to steroids, switch to azathioprine for long-term treatment to get the patient off steroids. If there is no response to steroids or azathioprine, try cyclophosphamide. Agents to decrease the rate of progression of idiopathic pulmonary fibrosis, IPF. Pirfenidone and nintedanib slow the rate of fibrosis. Pirfenidone is an anti-fibrotic agent that inhibits collagen synthesis. Nintedanib is a tyrosine kinase inhibitor that blocks fibrogenic growth factors and inhibits fibroblasts.